Good morning, everyone. It's a few minutes past 10 o'clock. If we could commence this morning's meeting with just welcome and introductions. Please just feel free to chip in, and I'm sure we'll get everyone covered. Can we start with you, Fran, as you're top of my screen?
Thank you. I'm Fran Godric, and I'm Vice Chair of the Isles City Council. Good morning.
Dan?
Dan Marcus, Lead Member for Adults and Lead Member for Planning and Vice Chair of Health and Wellbeing.
Paul?
Paul Charles, Chair of Health Watch Isles of Scilly.
Robert?
Good morning, Robert Francis, Chairman of Council.
Aisling?
Hello, it's Aisling Khan. God, what am I now? So, Senior Manager for Services to our Community.
Rachel?
Hi, Rachel Wigglesworth, Interim Director of Public Health, Cornwall and the Isles of Scilly.
Jonathan?
Hi, Jonathan First, Lead Member for Environment and Climate Change.
Have I missed anyone? They're the only faces I can see on my screen. I don't know if anyone else is not been called yet. So, Bob, just for the record, we are core with the people who are present.
That's correct, Chair.
Thank you very much. And I think last time I just had to technically read out that this will be a virtual meeting with remote attendance by councillors and members, and the meeting is being broadcast on Facebook for the general public. Have I got any declarations of interest as item 1 on our agenda, please? Councillor Grosset?
I'd like to declare, Chairman, please, that I sit as a representative for the Council on the Cornwall Partnership Trust, and I also have a family member who is involved in the Haven project.
Thanks very much. Any further declarations of interest at this stage? I think we can move on to agenda item 2, which is minutes of previous meeting. Do I have any comments in terms of factual accuracy or a proposer or seconder for those, please?
I'll propose the minutes.
I'll second them.
Thanks very much indeed. I have no urgent items under agenda item 3, which I think takes us then to our part 1 papers, which is agenda item 4, update from the Health Protection Board, which Rachel, I think you're talking us through.
Thank you, Chair. Good morning, everybody. So I come to you to give that update around the COVID-19 situation in the main from my role as Director of Public Health. So clearly we've had the first 2 cases that are associated with the Isles of Scilly amongst residents, and this is after a very busy tourist season and a number of visitors. So this is clearly the first experience of that, but I want to sort of reassure people that those cases have been worked with in terms of identifying the source of exposure, so that means where they could have been infected, and also that was off the islands, and that we have done the contact tracing that is required to ensure that we've reduced the risk of any further transmission from those cases. They are isolating. And their households together. So we think that the risks have been mitigated in terms of any further spread on the island. So clearly this is the first experience we've exercised a number of times because there have been a number of suspected cases. But I think I want to say that we understand the situation, where they were infected, and this is at the moment no cause for concern. So over the period that tests have been available in the Isles of Scilly, 67 tests have been completed. So this is the first 2 cases, and as I say, it's from imported from outside of the island and not transmitted from within the community. But in general, the context for Cornwall and the Isles of Scilly is that it is in line with the national picture, which is there's a slow, steady rise in the number of cases. You may have seen from local media that we have had a significant increase in Cornwall and Isles of Scilly in the past 7 days. So we now have 76 confirmed cases. in the last 7-day period for the whole of Cornwall. That is just 2 in the Isles of Scilly. So this does raise our alert level, but I want to sort of describe, and what we've been discussing in the Health Protection Board is the origin of lots of those cases can be attributed to 2 specific outbreaks. One which was HMS Raleigh in 4 Points, which is a setting where naval recruits essentially are on the base. So that has been managed by the infection control team on site with the MOD, and they continue to test cases. So that will be showing up on our mapping of coronavirus cases, which is available publicly, to see that there's obviously an association in that area, and we're aware of those. But no evidence of any further spread outside of that area or through in Plymouth at this time. So well contained, well managed at the moment. The second sort of area of higher cases are attributed to the tulip factory in Camborne Pool, which is detected through our test and trace approach within Cornwall, where we actually followed up with one particular case, identified that they worked in this meat factory, and we've been working very closely with the employer to go then to carry out some further testing, which identified there was a number of cases. So we then moved to full testing of that site, which will be a significant number of people, but over this week. So clearly there's a changing picture, but a number of cases very specifically associated with that workplace. So we do know that those types of workplaces are quite high risk. We had already engaged with, and we still engage with a number of these types of food production sites, and I can explain the risks if someone asks me that question, but I won't go into the details. But clearly there's a number of factors which have made those places a higher risk for infections of COVID and further spread. So we're working hard to contain those, and currently there's no, again, evidence that we've got any significant spread into the community around Camborne Pool and Redruth, but clearly we're keeping a close eye on that, and there have been press releases issued around that. So that's just a summary of the Cornwall situation, but in the previous period to the last report to the Health and Wellbeing Board, we have been challenged with quite a lot of testing on the mainland, so I think I wanted to reassure people in the Isles of Scilly that the testing that has been made available to you and your population is working smoothly compared to the use of the commercial online Pillar 2, we call it, the testing where you book online on the mainland. So we have had significant difficulties with people, particularly in the return to school, being able to access testing, which is, although we do have slightly higher testing than previous weeks, it's just the demand is going up in line with symptoms at school, in line with people needing tests to go to NHS appointments and inpatient appointments, a number of factors, meaning clearly that there's increased demand and the system wasn't able to keep up with that, as some of the testing through that route has been prioritised in areas with much higher prevalence of COVID-19 cases. So that's clearly the position as we're waiting for the significant ramping up of testing that's been promised to 500,000 tests a day. So we look forward to that, but we have made our position clear for Cornwall anyway, for the continued sort of supply of testing to meet the demand, so that we can have a clear picture of what's going on within the community. So we have had a slight rise in our positivity rate as well, but that's again in relation to the Cornish population. So I think they're the main things that I wanted to share. Obviously, there's been quite a lot of new guidance that has landed as well, which I know that the Isles of Scilly are been sharing with the population, which includes the rule of 6 and now the changes in terms of the hospitality industry and restriction of timings and use of table service. So I won't go into them, but I'm assuming that people can refer to the .gov.uk website, which summarises those changing guidance and the update for that. So at the moment we're operating on a sort of level 2 out of 5 in terms of our concern for the coronavirus case and situation for Cornwall and the Isles of Scilly, but acknowledge that the national picture is probably moving about 3 to 4 weeks possibly ahead of us in the southwest in terms of the numbers of cases. So I hope that's a useful update from the Health Protection Board. Clearly the numbers of cases change daily, but that's where we are now. Thank you.
Thanks for the benefit of the people who might be joining us remotely via Facebook, could you just emphasise the importance of patient confidentiality for particularly on Silly? There's been lots of Facebook chatter asking who the individuals are, where they live, what they do, where they've been, those sorts of things. Perhaps from a professional point of view, could you just explain why that information won't be forthcoming?
Yeah. So clearly on the mainland, this has been an issue from the beginning of the pandemic, and you know, some particularly early cases have created a lot of interest, and people are clearly concerned about whether it's something that's affecting their neighbourhood. But I think the important thing is that, like your health information, this is absolutely sort of confidential, and people have the right to privacy around their own context. It's important that we don't put additional pressure on those particular cases. And it is like sharing confidential private health information. So it's really important that we respect people, give them the space to recover, and acknowledge that the public health actions are being taken to protect you, and that this isn't something that you need to sort of get involved with, apart from clearly continue to take the public health precautions to stop you becoming infected. So rather than needing to know exactly everything about those cases, the action you should be taking is about being aware about not touching your mouth, being aware of washing your hands and keeping that distance, which will protect you from being infected. But I think it is, as I say, I think we'd all agree it is around that personal confidentiality is really important.
Thanks very much. Councillor Grosset, you've got your hand up. I think you're muted at present. Councillor Grosset, we can't hear you. We can't.
Sorry, apologies. Thank you for the clarification about confidentiality, which obviously in a small community is even more, can even be more challenging. But I'd just like really to say thank you to everyone on Ireland and off Ireland who has worked to let us have a bespoke and efficient testing situation, which is so pivotal. So I'd just like that recorded, please, because I'm sure all my colleagues share our very grateful thanks for that, and it's really, really useful. Thank you.
Thank you. Any further questions people would like to ask at this stage? Councillor Marcus?
Yes, thanks. Just the questions I've been asked are about the policing of self-isolation, like who is responsible for that and how is that going to work, which I kind of like to flip that round really about, are we providing enough support for people who are self-isolating? Is there going to be enough support there, and what is that support going to be? And the other question I've been asked is about, there's been figures in the press about the sort of success of track and trace, which is it's not a criticism, but there's been numbers bandied about in the press about 20% of people, only 20% of people self-isolating. And Rachel, it'd be quite interesting to hear your comments on those 2 points, please.
Thank you. So we are fortunate in that we do have a public health led contact tracing team. So that obviously, the local incident response team in the Isle of Scilly forms part of that, and we do have the support offered to cases to ensure that they're self-isolating. So we have conversations on the phone. We would have already had those conversations around their movements and the exposure that I talked about earlier, so that we understand exactly what's come on and we backward trace. But in terms of that support offer, that's where that discussion would happen. And so for the particular the Isle of Scilly context, I think that's very well established. And I know that the incident response team have doing a super job in terms of making sure that's available. In areas with higher numbers of cases, that isn't a concern. That's why Cornwall Public Health Team did establish this contact tracing additional enhanced support on top of the national scheme, which is very much an online text-based system, whereas our personal phone call has been really well received, and so we essentially are, doing an enhanced process on top of that more digital and sort of national approach. So that seems to be going well, although we do have reasonable take-up of the national test and trace scheme as well in the Cornwall and Isles of Scilly setting. I think we have 70. I'm just trying to get the number up in front of me. So 69% of all cases have completed the national test and trace, and that is, it does change, but that's the data that we have today, and that's reasonable compared to the national picture, but not ideal. Hence our more localised approach at the moment, and we aim to speak to every case in Cornwall, and we have been able to do that since the end of August to date.
Sorry to be really rude, Chairman, it's Ashlyn. I haven't got my hand symbol, so just wanted to follow on from exactly what Rachel said. So we have put additional capacity into precisely this bit around how we support people to self-isolate safely, how to reassure people who might be supporting those who are self-isolating safely, and to have that personal and bespoke service. Because obviously in a small community it's really even more important that we keep things calm. That is a huge aspect of outbreak management. And so you will see in the Better Care Fund paper later on, that's why I'm suggesting that we have a scheme to support that additional capacity so that we can make sure that people's emotional and physical needs are met during extended periods of self-isolation.
Thanks very much. Councillor Smith, your hand is up.
Yeah, thank you, Chairman. Thanks, Rachel, for that information. And just to preface, I would very much support what Councillor Grottick says about our thanks to be able to access the Pillar 1 testing, which makes a huge difference on the island. I think the information you just provided us in the last 10 minutes has really will be quite reassuring to the public. I think it'd be remiss of me not to mention that there have been issues in communication. I think that initial communication that went out with the first cases was frankly inadequate, and we received a lot of community feedback which was quite negative. What you just told us today, that sort of information would have been a lot more helpful and calmed the situation down, I think. So just sort of something for the record there. All in all, I think we're very thankful of the system that's up and running. I'd like to publicly state I'd support our council team, public health team, and what they've done to help us prepare for this situation, which has been brilliant. And let's hope that this is an isolated case and it doesn't get into the community. So an overall thanks, but just a note on communication. Thank you.
Thanks very much. I'm just mindful there's been a huge amount of publicity this morning about the app. I just wondered whether it was you wanted to promote that at all, Rachel?
Yes, thank you. So the app is is launched today, actually. In fact, I was thinking that it was a few more days, but yes, this has caught up with us today. It's being launched. So you should have a lot of national media around that. So the invitation is part of the tool in the box. So I think having learned from the testing of the app in the Isles of Scilly, they've considerably adapted it so that it doesn't take so much personal information. There was a lot of concern about it, harvesting data, people being able to sort of extract information from phones, etc. So this is an updated version whereby most of the data stays on the phone. So it's much more secure. We really encourage people to use it, to try it out. The idea is that it will track if you check into a particular setting, like a cafe or a restaurant that has a poster displayed. It can then record your movements through the phone. So if you do become a case, you can then track and understand where you've been. It will give you alerts if you live in a particular area with a high incidence. So there's a number of functions on the app which will be helpful for users, but also it will help us to be able to manage that contact tracing and that looking back, which actually people find really hard to do. So when you talk to someone and say, well, what did you do in the last 7 days? It's quite surprising how, if you don't have it written in a diary, you really struggle to think, well, what did I do on Monday week or whatever. So that's sort of example. We're asking workplaces and the businesses that are that fall under this category, who usually would take a name on a list when you go into the premises. So those sorts of settings, they will be asked to display this QR code, which then the smartphone can use. But they will be expected to run a check-in system by pen and paper as well, to make sure that also covers people who don't use a phone. So it is just one tool in the box. It's not the answer to tracking everywhere we go and every person that we've been near to, but it will help, and I really encourage people to use it, to understand it, to try it out, and to talk to each other about it if you're not sure as well. So I'm sure there's people that are more tech savvy than others who might encourage people to help do that, and it might be something you want to think about in the Isles of Scilly around having someone who could answer those questions locally.
Thank you very much. I don't see any further hands up, but I think from what I'm taking away from what you've said over the last 15 minutes or so is a message of reassurance that testing, tracking, tracing, the plans around containment are well in place for Scilly, and we should follow the public health guidelines to minimise any risk to individuals.
Chairman, could I come in, please?
Please do.
Robert. Thank you. I would just like to thank Rachel very much for her report. I'm not particularly happy with the criticism over the comms yesterday. Yesterday was a very difficult day. Dr. Whitney Curry has done an excellent job supporting you. Yes, it was unfortunate on what had to be put across, and it's much more clarified today. Thank you very much for that, which indeed the public will be very thankful for. But I think we have to just understand that with the confidentiality issues and with this happening very quickly yesterday and comms having to go out, the measure of those comms could not be dealt with any better, and now you're able to give the information which the public now have. So I don't want to support criticism of that. I want to actually thank Dr. Whitney Curry and yourself for all the support you're giving the Isles of Scilly. Thank you very much.
Thank you, Chairman. We don't have a formal report with a formal recommendation, so I guess Bob and Andy can advise. I assume as a board we're noting the content and don't need to have a formal vote or anything like that to take it further.
So can you hear me?
Yes, I can hear you.
If you were just to resolve to note the update, the verbal update, discussions that's just taken place, that would be sufficient.
Thanks very much. So does that allow us to move on to agenda item 5, which is our Health Watch update, which is in the hands of Paul Charnock.
Thank you, Chair, and hello and good morning to everyone who I haven't been able to speak to so far. You have a report in your papers. I'm just going to refer to what you can call edited highlights and prepared to take questions afterwards, if that's okay. We've continued our work. This week there was a meeting of the Medical Travel and Transport Group, which is one of the fundamental works that we undertake because of the nature of how we access medical services on Scilly. We've continued to discuss issues that are raised with us. Can give a little bit more detail in that we do regularly monitor issues such as stretcher flights, X-rays and physio appointments taking place on St Mary's, vulnerable adults and escorts, hospital discharge, and all of these matters are taken up and discussed in the meeting of agencies who work with us and with whom we work. Now there's issues that arise with us about NHS treatment. It has to be said that locally we believe that the services are provided are really very good indeed. Any issues that we do have with mainland, we're taking on with the patient experience team there. So that's an area that we work in. One of our purposes is signposting, which we continue to people. Not many people call in our office at the present moment, and we don't really welcome it as such because of COVID instructions, or the COVID situation and instructions from Health Watch England. And I think other services and agencies will be in a similar position to ourselves. We attend all the meetings that we can do virtually, and we haven't had any reports of any great difficulties in that area, although maybe the personal touch sometimes is something that I certainly miss, rather than talking to myself on a screen. And the other Health Watch activities, contact with members of the community. We work closely with adult social care, so that's an area to whom we signpost on a regular basis. We continue to telephone and contact people on a weekly basis. The number of calls we can make can be anything between 30 to 40. I think this is one of the fundamental important things that we really do, because there are people on Scilly, though it's a nice place, though the community is very supportive, there are people on Scilly who are vulnerable and who apparently don't have a great deal of contact with people and don't always know with whom to raise an issue. So those phone calls, the feedback we get is very positive about them. What we've also been doing for some little while now is every now and again we conduct mini surveys, usually through our website. We've covered areas such as healthcare, X-rays, any issue off Ireland travel to access X-rays and physio. We have a board meeting next week where I will be raising this issue for discussion, and I fully expect that we will be prepared to conduct a little mini survey around the islands so we can capture the real stories about how people, in some instances, have had to pay, I believe, in the region of £89 to access an X-ray or physio service that's being provided on the island. There are other examples as well as some difficulties. It basically surrounds the day that these services can be provided from the mainland. At the present moment, they're provided on a Wednesday, whereas somehow the better day for off-islanders is a Thursday. But we will be capturing some of those issues for presentation, most probably to this board or to the council itself and other agencies. We conducted a mini survey on how COVID-19 has impacted on mental health. We had a good response, and sort of hats off to St Mary's mental health team, nurse and support, because there's a very positive response by respondents to the services provided, particularly during this very trying time. We also undertook a medical travel, picking up problems that arranging the travel warrant in the first place, and any other issues that people were experiencing. Again, those sorts of things we have taken to the medical transport and travel group for resolving, hopefully. We can continue our work with Macmillan Trust, which is a relationship that is developing at great speed. Our community engagement continues. The indications are there on a little pie chart. 365 people actually made phone calls in the last couple of months to us, and as indicated, 337 people have accessed the website for information there, and you will have seen every now and again something come up from Health Watch, from ourselves on Facebook. clear that we receive community feedback and we feed it to the appropriate people or agencies as and when. More than that, the only thing I wish to add is that it's a personal issue which I don't have any difficulty in sharing with you. But I recently had to have a cardiac issue dealt with at Trelisk, and the process required me to have a COVID test 72 hours before the procedure. That all went very smoothly indeed. The pack was delivered to me. I delivered it back to the hospital. I received a response the following day, which I was quite impressed with. The only complication was that it was a private company that seemed to be undertaking these tests, a worldwide security company. And what they sent was a website which you had to travel through somehow to actually get the answer to whether you were negative, positive or indifferent. I just sent them an email back saying, just let me know by telephone or email, please, the results, which they did. But I do imagine that there's an assumption that there's people can use IT and what goes with it. And I just wonder how people deal with that if they have to go into hospital and before admission have to have a test of some kind. I have raised that with the company, and they said that they are taking it on board, and we're raising it with Healthwatch Cornwall to see if they've experienced similar difficulties. After that, some difficulty with booking the flight, but we got there. After that, I have to congratulate Trelisk Hospital and all there for the superb care I received. And, it's just brilliant. The most promising thing I've felt, which pleased me most, is whilst I became a day patient because I couldn't be sent back to a hotel to recover completely. But whilst I was recumbent on the hospital bed, a lady popped into the private room that I had and said, "You're from the Isles of Scilly?" "Yes." "I'm here to get you home." And I was most impressed that on this occasion, because we do have problems expecting a large number of hospital staff to know the process for getting a patient home from admission to a hospital. But it seems as if there are some people working in the hospital whose specific role is to do that. So we're taking that up further, and our congratulations to Trelisk were being raised at the meeting just a couple of days ago. But promising movements, and I'm feeling absolutely excellent. So thank you to Trelisk and the NHS. If there are any questions, please raise them. No problem.
Thank you, Paul. You look fit and well to me, so thank you for the first-hand feedback on some of the services. Any questions relating to Paul's report, please? Councillor Grotic. I think your microphone is off, Councillor Grotic.
Sorry. Right. I'm glad Paul is safely home. I'd just like to say that it's a very welcome focus within this report that Healthwatch are monitoring the discharge situation. And it's difficult to know exactly what point Healthwatch and the Medical Transport Travel Group can actually take the responsibility for raising queries about the state at which someone's health issues should be focused on before they actually return home. We recently had a couple of, 2 cases, I think at least, where islanders have actually been programmed to return home, have got as far as the aircraft and have not been able to access the aircraft safely because their medical condition did not allow them to safely enter the aircraft under their own steam. And I think it is an issue, especially this will be exacerbated by COVID and close contact, but we really do have to look very carefully, I think, at what we can do to avoid this. Because quite frankly, if you can't climb the steps unaided into the aircraft, it will make sense to keep you on the mainland until you're a bit stronger. but I recognise this is straying into the medical areas, and I'm just not sure how we are going to monitor this. But I hope that Healthwatch and the Medical Travel and Transport Group can continue to keep a very careful eye on this, because it has led to some very disappointing and challenging feedback again on social media, and obviously some very difficult situations for a local family. Thank you.
Thank you. Did you wish to come back on that comment, Paul?
Yes. It's stories that we require like that. Sort of the real life things, rather than things that we maybe believe people are experiencing. If we get the real stories, then we would pass them through to the patient experience nurses. I believe there's several who work in the hospital, and also raise it at the medical transport group as appropriate. It's a medical decision as to whether someone should be discharged from hospital. Being in the hospital and seeing how busy it is, I think there are reasons why sometimes things don't go quite as expected. But even so, people from Scilly should have some sort of marker, I suppose, that says make sure that these people who are now well from their but that they should be able to travel back. It's our job to know what people's experience is and feed it back and follow up if necessary.
Thanks very much. I think Councillor Marcus, your hand was up next.
Sure, thank you. Paul, yeah, it's a really interesting report. Focusing on the digital side of it, you make a really good point about digital exclusion, and it'd be interesting to see how, especially over the winter, how we can counter that and work with our community to make sure that everyone's got access to those tools and scenarios that require digital connectivity. In the report, it says, asks some clarity really. You've got virtual and video consultations. It'd be good to know what the difference between those are. And it's kind of, this report says that reducing the need to travel, although it's ongoing, there's been a significant improvement with the implementation of remote consultations and appointments, but there's no context to that at all. So it'd be good to see how that's improving and how we can make sure that that improvement is kept for the future to make appointments more accessible and less expensive, more affordable for all the agencies involved. That's it from me.
Could I come back, Chair?
Please do, yes.
Oh, I thought I had to raise my hand for a moment. I can only go by my own experience, and our staff would be able to give far more detail on the feedback that they've been having about virtual appointments, etc. So my apologies for that. My own experience is that it's worked well for me in talking to our local GPs when necessary, other than on one occasion, which started with the whole process off of this current problem that I experienced. It started off by a doctor stating that you're out of breath, which would not have been picked up in a telephone conversation. Being out of breath led on to various other tests. I think there is a skill in deciding where, when, how, and if virtual, it has its role. Telephone consultations have their role, but you need to take some care about that. The other issue, which I really didn't make a big enough point about, is that we hope to be building on our contact with people in the community, some of them who are a little bit more difficult to reach, through the telephone system and through the shopping prescription obtaining service that we've put together. We are looking at developing a volunteer service, and our two staff, Karen and Catherine, are being trained in all aspects of voluntary activity, how you go about it, how you do it, rules, regulations, legal issues, etc. And we're working very closely with adult care on the islands, and we hope, if the board agree, to develop that service. Hopefully, that will also assist in reaching people who may not be so IT experienced. But we can't. But there is a general assumption, I think, sometimes that we put it on the web, or you can access this information on a website. And of course, I would imagine quite a good proportion of people haven't got a clue what that means. It is an issue, particularly not having a sort of daily newspaper as well, perhaps, or about the islands, etc.
I think some of those points we might pick up on our next agenda item in a few minutes when we talk better care fund allocations. Just for the sake of, just going back to Councillor Grottick's comment about comments on social media about accessibility in hospitals and things like that. Just for clarification, I assume you need a formal referral to you at Healthwatch rather than just relying on a Facebook post when it comes to some of these narratives that you discussed.
I've collected issues in the street. We will listen to any point that needs to be made. If some points are made to us which have nothing to do with Healthwatch whatsoever, and some points are irrelevant, which to health and medical care. But we will listen, and if sufficient people, if it develops into, or if it looks as if it can develop into a major issue, then we will raise it. If sufficient people contact us about and be a minor issue, we will raise it. We have to make a judgment.
Thanks very much. Councillor Smith, you've had your hand up.
Yeah, thank you, Chairman. Thanks again, Paul, for an interesting report. Always good to hear about the work of Healthwatch, and I think we're all very appreciative of what you do. It's such a great service, so thank you. Just to pick up actually on the discussion around the online consultations, which I think is a really positive move, in terms of time and cost and carbon emissions as well. Have you picked up any particular problems with the service? Anything particularly noteworthy?
I'm not aware of any, but that doesn't mean that Karen and Catherine, they haven't mentioned any to me or any difficulties. Other than it can be quite a lot of phone calls that are made, but I think they're all worthwhile.
Yeah, I was just it seems such a good news story. I was just checking there wasn't any sort of major downside to it. I mean, Chairman, I don't know about you, but I feel like I recommend we do some sort of press around this, because it just feels like such a good news story to me. That coming out of a difficult situation, that, and goodness, we need a bit of good news at the minute, don't we? So if there's something that's working really well and is providing a positive benefit in many ways, then I think it'd be worth doing some press around it myself.
Excellent idea. But I do have a press cutting here, which is from. It's got our two staff, Karen and Catherine, smiling on the front. They're always smiling. But it's a nice little article about some of the things that they've been doing recently, particularly helping with shopping, etc. And I'm particularly pleased to be referred to as Councillor Charnock. So that's fine by me. I look forward to a check in the post, maybe, if you get paid for being a councillor.
I was going to say you animated yourself, but I'm not sure.
No, it wasn't me. So that was very helpful. And we did inform Healthwatch England of of the praise that we received by the good people of the council and other agencies, and that we made it into the newspaper for the right reasons. And they were very pleased as well. So,
if technology allows, Paul, and you'd be able to send me a copy of the article, I'd be happy to send it to our wider council membership, just to share it.
But I might have to do another photograph with everybody else in the team, because but yeah, I'll do that, no problem.
Any further questions to Paul at this stage?
Yeah, could I just also pick up on the X-ray issues? You know, I've been banging on about this one. I know you had a medical travel and transport group meeting, was it a couple of days ago? Were there any issues or any resolution to the issue there at that group?
Unfortunately, I don't know.
Okay.
I don't know.
I think I heard from
produced. I've got
the leg. There may be
one person is on leave, and the other person has had medical issue, gone to the mainland. So I haven't had opportunity to discuss that.
Okay. I mean, the main point for me is that I think it is very urgent. We're heading into a situation where, what are we now? About 5 or 6 weeks of scheduled boating left. Then we move to winter boating. So for F-Lines, it does become a serious problem. So speed is of the essence, and as you pointed out, it can cost an awful lot of money for people to just get to St Mary's to access basic healthcare, which is an absolute nonsense. It's totally inequitable, and this situation just has to be resolved. So I would, urge you in the strongest possible terms, and all the board here, to get this issue sorted, so people just can access the medical help that they need at an affordable price. So, thank you.
Thank you.
Thank you. There's one matter, Paul, I'll pick up outside the meeting regarding Healthwatch, which is a comment I've had from the local parent-carer group around children with special educational needs and Healthwatch input. But I'll get some more information, perhaps we can touch on that at a later point. We've got one recommendation, is that members note the activity that Healthwatch Isles of Scilly have done. We've asked for questions and clarifications have been provided. So do I have a proposer and seconder for that recommendation?
I'll propose that.
Thank you. And Councillor Bruffitt, your hand is up.
Yeah, I'll second that.
So I think that moves us on to agenda item 6. And am I correct in thinking, Jill Thornton, are you on our line now?
I am, yep. I'm sorry. I don't have a hand, or I can't find it, so I may just have to butt in accordingly.
Yeah, you're very welcome to our conversation. You missed our introductions earlier, but I'm glad you're with us now. But please do butt in. I think, Aisling, if you want to kick off on agenda item 6, and anyone can butt in as and when required.
Okay, thank you, and thank you, Joel. I've run through the schemes with the chairman already, and with Jill Thornton, my counterpart at CCG. So I'm just going to give you a quick description of how we plan to use the Better Care Fund this year. Those of you who've been on the board for a while will know that it's a fund to support shared priorities across the health and social care system. It's a really good allocation, but it also is a bit awkward because we don't know from year to year what we're going to get. So you have to think about in-year spending and what you can commission rapidly. And given what we're dealing with this year, we need to be pragmatic about the best use of resources to meet the needs of our community. And I think some of the things we talked about earlier and the themes coming out, I'm hoping that some of these schemes will meet those. So your oversight and your approval is how we allocate the 181,000 through the Better Care Fund, the 26k through the Disabled Facilities Grant, and the 79k through the Improved Better Care Fund. So the proposal is that we, as you know, somebody was talking earlier about mental health services, how good they are on the islands currently and how appreciative people are of the on-island service that we now have. So my proposal is we funded up till January through previous allocations. So my proposal is we extend from January to March, so the whole financial year is covered. I propose that we continue with reablement and intermediate care, which is even more important now, which is being able to provide people with the 6 weeks free at the point of delivery support to avoid hospital readmission, and also to support people coming out of acute beds getting some intense support and then being able to return to independent living. We did really well on this scheme last year. Access to services remains in place at kind of the levels that we funded before, which is buzzer bus and concessionary fares. And that does include health passes, which people are talking about. Currently, that is only for people over 60 and for those with disabilities. And if members want to consider how that might be in this year expanded to other groups at risk of inclusion, then please let me know. I'm expecting this budget to be a bit odd this year for obvious reasons. Obviously, the standing costs of buzzer bus remain and income has been lower. Thank you so much to the service for continuing to run all the way through lockdown and beyond. It's still so important, and as you know, we get fantastic anecdotal feedback. And concessionary break fares are in place. I still think amongst the population that we're targeting, there's still slight nervousness about moving around, but it's there and in place and absolutely supports access to health services on St Mary's. Members will be aware that access to acute services on the mainland, your costs are covered from the point of departure, i.e. your home. So this is only about appointments on St Mary's. Then we've got Healthy Ageing, which is again a good recurrent scheme. We were making huge headway. We commissioned iCare, iMove, who are doing a programme with Cornwall to create a multi-agency partnership, hugely skilled in frailty and how you approach it, and do not assume that because you're getting older that certain outcomes are inevitable. So it's about a full and happy old age. And we had a really good partnership in place, logos, branding, and access to an online portal for direct delivery of classes. Now, obviously, that work is going to be a bit curtailed because it does require face-to-face training, etc. So what we're thinking for this year is to create an online access portal so that we can encourage all of those who may be feeling a bit isolated this winter for various reasons to do some exercises, and that ranges from Tai Chi, meditation, falls prevention. I think it would be a really good service to keep people fit and well, you know, whether they're self-isolating or just necessarily indoors a bit more. Then there's a recurrent scheme where we provide some money to the Cornwall Equipment Loan Store, and that's, you know, making sure that we have access to all sorts of adaptive equipment to support independent living. Then, again, recurrent, you have supported before, capacity within the system. Capacity means people, essentially, so that we have the internal staffing to lead on the health and social care integration project, and all of you will be aware, I'm sure, that we've submitted an outline business case, waiting to hear, but also on a kind of day-to-day basis, we're not just waiting for, you know, confirmation of funding, we are also, you know, running MDTs and minuting those meetings and really driving forward how we work together as a single team. So then there's a new one, which is the model of care coordination. So you'll be aware that we have developed as a local system a model of care to make sure that we minimise all the various aspects of the impact of COVID and also now flu and social isolation on the Isles of Scilly. Lots of aspects of that model of care are funded through existing streams, but there has been additional capacity that we want to put in, which is, I think, things we talked about earlier around test and trace, around the bespoke hand-holding service we'd like to provide to those affected by COVID, and whether that's in terms of being asked to self-isolate through emotional wellbeing issues, through signposting to Health Watch, who's been fantastic. Then that brings me neatly on to the Health Watch volunteers. I think I'd like to recognise that the kind of heroism of this organisation in stepping into a gap we've had on the island for some time, which is the coordination of voluntary sector activity. We've got so many very good and kind people on the island, but it's quite fragmented and it relies on certain individuals. Health Watch has sort of galvanised and created a focus for all of those people. And what I'd like to do is give them some money to support the work that they're doing with their peers in Volunteer Cornwall through training support, branding, making sure that all their volunteers have got, you know, undertaken the necessary training. And I think, you know, if we were to get an allocation to the Best Care Fund next year, I think we could look at something even more ambitious. But this is basically, you know, to get us through this winter, I'd like to recognise the additional investment that I'd like to give them so that they can continue to do something that we've been needing on the island for a long time. And there's huge bits of work they're doing around befriending and signposting, and it's been brilliant. For IBCF, what we've spent that money on historically is recruitment and retention of the adult social care workforce. So it funds a market force that is supplement to make sure that our careers in care remain competitive within the island context. It has been hugely successful. So as you will remember, a few years ago we had huge risk of closure due to staff shortages. And through this investment, partly that and lots of other things, we are now fully staffed, which is obviously even more critical as we go into the winter months. So I would like to recommend that we continue that investment. And that's it from me.
Thank you very much. Did you wish to button at this point, Jill?
No, just to say that the BCF obviously is a very different thing for the Isles, where nationally the BCF has previously had key performance indicators such as delayed discharges, non-elective admissions, and so therefore in some ways the aim of the national BCF doesn't translate well to the Isles of Scilly, but what we see in the Isles of Scilly BCF is absolutely integration in communities at its best. And I think the schemes within the BCF represent that.
Thank you very much. Those comments are very reassuring to hear. Paul, your hand is up. Paul, your hand is up?
Maybe I was trying to turn this off.
Fair enough. Does anyone have all right. Does anyone else have a query or question of Aisling or Jill or any of the projects that are outlined? Councillor Smith.
Thank you, Chairman. Just a question regarding the different schemes under the provision of Best Care Fund. Is there anything that has lost funding compared with last year? I just wasn't quite clear on that.
So nothing's lost funding. So and Dan queried that. So mental health services is a reduction in funding only because we paid for most of it already. So early intervention and prevention, which was about on-island physio services, that came to an end in I think it was, I can't remember. I think the final quarter we didn't do last year. So there isn't a way of recommissioning that this year. But we are in discussions through our model of care working about how we might look at therapy services from next financial year. It wouldn't be possible currently to access it in the way that we'd like to, but I think there is an area around therapies. But otherwise, things are pretty much where we were. There's a slight increase on integration, which reflects the work we're trying to do to kind of get this project over the line. So,
thanks, Aisling.
Yeah, I know. I think in a way, because
that's fine.
Papers in part 2, it's kind of cross-referencing. But I mean, I can assure you that there's been consultation to make sure that we are meeting community needs.
No, thank you. The only comment I'd make really is around access to services, as you just mentioned. Clearly both services are going to be massively undersubscribed over the past few months and probably going forward. There probably, I would argue, is a case for those on lower incomes to have some support, perhaps to access services on St Mary's, those from off-island. I don't know what members think about that as a principle, because, it feels like perhaps a decent use of money.
Yeah, so I just need, if you don't mind, can I just check with Jill, because I have some sympathy with that. It might not be something we could do again next year, but Jill, obviously the focus of Best Care Fund really tends to be at the frailty end. What would your idea be about it being more accessible across the age ranges, given that we're likely to have an underspend in this scheme?
Yeah, actually I think, Aisling, we did raise the query of the fact that we would have an underspend and what we would do with that. The only query I've got is that similarly you would have, there wouldn't be the same revenue, so I'm not sure what revenue gap you would have from the use of the buzzer bus revenue, if any of that would need to meet a pre-existing gap. But any underspend, obviously, it's for your community to decide how you want to spend that.
What I'll do, I think my latest Q1 figures, but I wouldn't mind seeing Q2 now, but I think we would have, an ability to do health specials. I don't think we can do the concessionary boat fare scheme universally, but I think we could do access to services on St Mary's, particularly as potentially it might be harder for services to come to the off-islands. So I think with a genuine kind of reason, I think we could maybe look at making that a universal offer for children, people on lower incomes, but we need to be really clear what that means. And maybe it's a case-by-case basis based on local knowledge. There's also a little bit of cost there around the administration of that, because I know it sounds like you just say, yes, of course you can, but there is a little bit of, therefore, backroom admin. So I think, Chairman, if you're happy, if you ask me to pursue that, and if I think we can fit it within the budget, I'll make it happen, so I don't have to come back to you all. Yeah. And if if it's not affordable, I'll let you know. But I think if we start it from October half term, when boating services change a lot, and get us to when, sort of March, when boating services pick up again, and we look at a universal offer for health access. Is that okay with everyone? I think we can afford it, from what I can see.
We'll leave that for your call to do some more investigation.
Yeah, and if I can do it, let's just get on with it.
I'd certainly welcome it, Aisling. Could you just send an email to members before you action it, just so that we can have oversight of it? It's
council members. So it's members of this board have oversight of the Better Care Fund.
Sorry, this board, yeah.
So this board, I can do. I don't know what I would be. I think I should just tell you by exception. I think it's going to be fine, looking at what I have seen so far in terms of budget monitoring.
It'd be certainly a welcome thing.
Well, we'll just do it on the same basis that we do it for currently, which is up to a maximum of 4. So therefore you minimise demand.
Chairman, are we happy to add that as an additional kind of recommendation? Then the board's given its approval, and it can be updated at a later date.
Okay, so we'll agree in principle to that.
Okay, and what I'll do, just to reassure everyone, give me a couple of weeks and I'll write back to you to tell you what I think the principles of the scheme will be. Just to give you belt and braces. I don't want anyone worrying.
Councillor Marcus, you've got your hand up.
Come on. Yeah, the only thing I would say on that is governance, basically. We just need to make sure that the scheme is run properly. But an email in the future would be great on that. It's good to see the importance of the mental health service, and that continues to be funded. I think that's going to be more to the fore over the next few months. And that's it from me, really.
Councillor Grottick.
Thank you, Chair. Yes, just a quick comment that I'm grateful that Aisling is going to look at it in a bit further detail offline, because while I certainly support it in principle, there are areas where there might be some overlap. For example, we might still have something in the budget from the Sports England funding, which we had to support family interaction with exercise and other beneficial areas. So I think Councillor Marcus is exactly right, and Bob as well, that there are governance aspects, and a quick look at the wider picture, I think, would be very, very beneficial. Thanks.
Yeah, just to clarify, this would only be for health passes, so it's for when you have an appointment letter. So we have governance set up already for over 60s and disabled people, so it would therefore apply in exactly the same way. So it would not be the recreational side. We do not have funding. It's simply just something on St Mary's rather than the mainland. Yeah, thank you, Fran.
Okay, fair enough.
Thank you very much. I can't see any further hands up. So for clarification, do we need a second recommendation on that point, or can we build that part of the conversation into, we have one formal recommendation, and then we're asking Aisling to go away and do some more clarification on the point which was raised by Councillor Smith.
Go on, Bob.
Oh, sorry. Yes, I think it would be more correct to have a second resolution, and it would be simply the recommendation that the board approves any underspend of the Better Care Fund in 2021 can be dedicated to improving further access to services using health special passes.
That sounds very articulate to me. So if we take recommendation and recommendation 2, which Bob has just outlined, do I have a proposer and seconder for those, please?
Could I just ask on a point of, so our discussion was about an underspend on a particular scheme, not the whole BCF, was my understanding. Does that make sense?
Yeah, absolutely. So basically, if we say the totality of that scheme is 50,000, whatever we come up with the kind of a slightly amended scheme needs to fit within that financial envelope.
Correct. Not the total BCF.
Correct, yes.
Thank you.
Thank you. It sounds like we're all on the same page on that one. So if we're happy to take a proposer and seconder for those 2 recommendations?
I'm happy to propose. Or second.
Second.
Anyone, any objections? I'll take silence as a no. Thanks very much. That concludes agenda item 6. And agenda item 7 is our health and wellbeing board forward plan, which I think, Bob, will you take us through?
Yes, very, very happy to, Chairman. This is much as you've seen before. It was updated following some comments that were made at the previous meeting in July. One aspect of note, there is in the development sessions a reference to the workshop that was intended to follow this meeting, but has necessarily been postponed. So that will be picked up at a later date, and there will be some initial discussion with yourself, the Vice Chair, and 1 or 2 other of the board members, just to make sure we have everything in place in terms of evidence and the intentions for that workshop when it does take place. But otherwise, I'll take the report as read and happy to kind of take notes on the board's views.
Thank you very much. Any further comments on this paper from board members, please?
Chairman, if I may, just a note about, we've got a note down on fuel poverty and a link to Smart Islands, just whether we can actually put a date to that and action it at some point.
Yeah, if I pick on that, I met with colleagues from Cornwall Council around issues around fuel poverty. They were over meeting our housing team and other senior members of staff, and they were looking on potentially putting a joint bid in for Cornwall and Scilly to address issues of fuel poverty. So perhaps it would just be worth finding out where we are with that application, because that would certainly, if it's successful, feed into that conversation. So I'll pick that up with Nicola and colleagues in Cornwall and make sure we've got a full suite of information perhaps in front of us for that.
Yeah, I agree.
We have 1 recommendation that the board approves the forward plan subject to any agreed changes. Do we have a proposer and seconder to pick up on that recommendation, please?
I'll propose it.
Thanks very much. And a seconder?
Yeah, I'll second.
Thank you ever so much. So I think that concludes the agenda for this morning's meeting. There's a part 2 Better Care Fund outturn performance which members can pick up on. But I have no further comments apart from to thank everyone for your time and effort this morning. And I think that concludes the meeting.
Thank you very much.
Thank you.
Thank you very much.
Thank you.
Thank you.
Well.
Yeah, Paul. I press hang up. You might still be on Facebook, you never know.
No,
It's a red one. That's it.